Good morning, everyone, and thank you for joining us this morning on this public hearing. I would like to advise everyone that we're going to be on live cable TV and I believe also on Facebook, LB Facebook. So again, thank you for joining us this morning. On behalf of the members of this standing committee, the EAGI, we would like to welcome Governor Tory's representative, Mr. Jason Palacios, the appointees, Ms. Stephanie Willis and Mr. Theodore Parker, elected officials, dignitary members of the general public. Before we proceed forward with this public hearing, let me first introduce the members of this committee. To my immediate right is the vice chairman of this committee, Senator Victor B. Hokuk from the island of Rhoda. And to my right side of the aisle is the floor leader of the Senate, Senator Vinny Sablan from the island of Saipan. And to my left side of the aisle is the vice president of the Senate, Senator Justo Kidigwa from the island of Saipan. And I'm the chairman of this committee, Senator Francisco Cruz from the island of Tinian. I would also like to announce a couple of things in the interest of informational purposes regarding House rules of our code of conduct during this public hearing. Today, the members of the Standing Committee are conducting a public hearing on the appointment of Ms. Stephanie Willis and Theodore Parker to serve as a members of the Healthcare Profession Licensing Board. The public will be invited to make comments as to whether you support or oppose the appointees before us this morning. However, any comments beyond the facts of the appointees or comments that are not directly related with this public hearing will not be entertained, and such comment will be removed from the record. At the same time, please observe minimal noises in disrupting this hearing process. Please turn your electronic to a silent mode. Thank you. Let us now begin. This public hearing is now in session. Today is June 13, 2022 at approximately 10:05 in the morning here in the Senate chamber on Capitol Hill, Saipan. This is a public hearing regarding the appointment of Ms. Stephanie Willis and Mr. Theodore Parker by Governor Rob DeLongre Torres to serve as a member of the Healthcare Profession Licensing Board, pursuant to Public Law 15-105, as amended by Public Law 16-25. Mr. Macaronas will be our clerk for this hearing. Mr. John Santos will be and Mr. Terlahi will be our sergeant at arms. And joining us this morning also, the IT of the LB is Mr. Kamatsu. They will all serve accordingly for this hearing. At this time, I would like to ask Mr. Macaronas to please call the roll.
Senator Francisco Q. Cruz,
Here.
Senator Victor B. Hokuk,
Here.
Senator Carl R. King Neighbors, Senator Justo S. Kitigua, Senator Vinny F. Sablon.
Present.
Mr. Chairman, 4 members are present, 1 member is absent.
Thank you, Mr. Macaronas. With 4 members present, we have the necessary number to proceed with the public hearing. However, Senator Carl Neighbors from the island of Tinian is excused for this hearing. And for the record, we have Brandon from the lower house. Legal counsel will be sitting in for this public hearing. At this time, do I hear a motion to adopt agenda?
Second.
There's a motion for the adoption of our public hearing for this morning's agenda and was seconded. All in favor of that motion, say aye. Opposed, say nay. Motion carries. At this time, I'd like to ask Sergeant Arm, please escort the appointees and the governor's rep into the chamber. And for the governor's rep, before you introduce the committee on the 2 appointees from the administration, please state your name for the record. Thank you.
Test.
Buenas and Hoffaday, Chairman Cruz, and honorable members of this committee. For the record, my name is Jason Palacios, representative for the Office of the Governor. On behalf of Governor Ralph De Langaro Torres, I thank you for the opportunity to continue to come and testify before you today. I am here to introduce Governor's nominees for the CNMI Healthcare Professional Licensing Board, Dr. Tiffany Lynn Willis and Mr. Theodore R. Parker. Dr. Willis is a highly regarded family practice physician with over 20 years of experience serving in multiple capacities in healthcare institutions across the Marianas, including the Commonwealth Healthcare Corporation, Cagman Community Healthcare Center, FHP Take Care Clinic, and Marianas Medical Center. Mr. Parker is also highly respected individual in our community with over 24 years of experience pharmaceutical in the pharmaceutical industry, serving as the general manager of PHI Pharmacy from 1996 to 2008, and then eventually started his own successful venture, opening Brabu Pharmacy, which is still currently serving the community to this day. Governor Torres places his full trust and confidence in Dr. Willis and Mr. Parker to continue to serve as members of the CNMI Healthcare Professional Licensing Board. I know they stand ready to answer your questions and present their plans for the future. Their long history of professional experience, credentials, and commitment to serving the Commonwealth in this capacity makes them viable candidates, and we kindly ask for your expeditious approval. Thank you for the opportunity to introduce them to this august body. Thank you again.
Thank you, Mr. Palacios. And before I recognize the appointees to deliver testimony this morning, first I would like to ask you again both to please rise so that the clerk can administer the oath, both of you, Mr. Parker and Ms. Willis.
Dr. Tiffany Lynn Willis and Mr. Theodore R. Parker, you do solemnly swear under the penalty of perjury that the testimony you shall give in the matter at hand shall be the truth, the whole truth, and nothing but the truth. Thank you.
Thank you. You may sit. Since you both didn't raise your hand, but you agreed to the oath this morning. At this time, I'd like to recognize, but before I recognize Ms. Willis, I know both of you have submitted the required document by this committee as but if you have anything else that you wish to add into the submission of those required documents, feel free to present this morning. I will start with Ms. Willis.
Yes, hi. I just wanted to say thank you very much for inviting me here today. And I just want to help continue to serve the patients and the people of the CNMI and helping to protect them and license appropriate not only physicians, but all of the licensees that we do through the licensing board. I just want to thank you for another opportunity to do so. Thanks.
Thank you, Mr. Parker.
Good morning, everybody. I too would like to thank you for this opportunity to continue to serve on our board. We have a lot of things planned going forward in terms of modernization. There's a lot of things that we plan on doing in terms of bringing the CNMI in terms of its licensing of medical professions into the 21st century. We have a lot of work ahead of us, and I know that we have very capable people. And once again, I just really appreciate the opportunity to continue to serve. Thank you.
Thank you, Mr. Parker. And before I recognize the members of the public that are in the gallery to deliver testimony, first I would like to recognize those entities that are invited to participate in this public hearing. First on the list from the Honorable Mayor David M. Apatang's office. Anyone from the Mayor's office of the island of Saipan? No one? Let the record reflect that there's no one from the Saipan Mayor's Office of the Honorable Mayor David M. Apatang, the Honorable Mayor Vicente Santos from the Northern Island, anyone from the Mayor's Office of Northern Island? No one? Let the record reflect that there's no one from the Northern Ireland Mayor's Office. From the Saipan 16 and Northern Ireland Municipal Council. Anyone from that office? No one? Let the record reflect that there's no one from the Saipan 16 Northern Islands Municipal Council. Or rather, Saipan and Northern Ireland Municipal Council. The Executive Director of the Healthcare Profession Licensing Board, Ms. Esther S. Fleming. Anyone from that office? You wish to?
Ms. Fleming is off island at the moment, so she was unable to attend today.
Thank you for that. But there's no one besides Ms. Fleming that willing to come, and no one? But thank you for that information. At this time, I would like to open the floor for public comment. Any members of the public that is in the gallery that wishes to deliver testimony, whether you're in support or not in support, you're welcome to come forward and deliver your testimony. But before you proceed, please state your name for the record. Public comment is now open. Anyone from the gallery that wishes to deliver testimony? No one? Once we close public comment, we will not return back to public comment. So no one? Let the record reflect that there's no one at this time to deliver public comment of the members of the general public that is in the gallery. At this time, I'd like to open the floor for the members of this committee to raise questions or concern in regards to the reappointment of both appointee this morning. Now, I would like to recognize the floor leader of the Senate, Senator Vinny Sablan from the island of Saipan.
Thank you, Mr. Chairman, and good morning to everyone that's present here in your Senate chamber and to all that are viewing on the media outlets on air. Good morning, Dr. Willis, and good morning, Ted. Thank you guys for being here, and thank you for accepting the reappointment from the governor to continue service in our Healthcare Professional Licensing Board. I have no specific questions, but I wanted just to ask maybe in general, during your tenure in the board, what challenges have you seen or felt in kind of ensuring to continue the service that you provide for the board? Are there any specific challenges that have came up in the past, or maybe high turnover of physicians or whatnot? And then maybe, Ted, you can also touch on those plans that you mentioned during your personal testimony on where the board members want to bring the board right now. So
Actually, the biggest challenge we have right now is with technology. If you were to renew your license in just about every other state in the United States, and I think even Guam, you can go online, you can give your credit card number, you renew it, you submit your renewal documents, and it's all done in a matter of seconds. We are still having to review applications manually via paper. People are still having to manually write checks to be deposited because we don't have a mechanism for allowing people to make direct deposits into the account. And I'm not going to even pretend to know how the accounting works. I know with governments, it can be kind of difficult to meld all those things together. But I think that would be the biggest challenge we have right now. And I know that's one that we've started to address and trying to get with the Munis system, I know with finance and whatnot. But that's been our biggest challenge in the past, is just the manual evaluation of everything as opposed to things being more online. So but we are working forward and trying to resolve those issues, I know. So
thank you, Ted. Doc, anything on your side?
I would just say the only other thing is just, I think, investigations into different applicants. We really don't have a full-time investigator, and we're having to use kind of on the side things to try and track down things about different applicants. And it would just be great if we would have a full-time investigator that was allotted to us to help us with that.
How many staff in the board, or you could, because you have Director Esther, and then
So 3 total.
there's 3 total
Yeah.
plus and we have a complete board right now, or do we have any vacancies?
We will have 1 vacancy here in a couple weeks.
Okay. Thank you, Mr. Chairman. No more questions. Then.
Thank you, Floor Leader. Now I'd like to recognize the Vice President of the Senate, Senator Justo Kirugua from the Island of Saipan.
This is Mossy, Mr. Chairman. I would like to thank both of you for, I know you two are very busy with your full-time job, but at the same time, you're still willing to provide or make your time to provide support to the licensing board. And that's one of the very important boards in the CNMI. So I thank you for, again, accepting the nomination to serve on this board. I have questions probably for, we're entertaining a bill, and it will affect both of your pharmacy, Mr. Parker, and also the Marianas Medical Center. That's where you work. Yeah. So,
Yeah.
But Mr. Parker, you submitted a comment on House Bill 2268, which is to establish a prescription drug monitoring program in the Commonwealth of the Northern Mariana Islands. And you submitted a comment, and I don't know whether you still remember this. You submitted a comment, and we did not adopt the bill that we discussed last week because we wanted to get more clarification on the comments that we received both from CHCC and from your comment. And in your comment, you mentioned about that. I am not so sure whether you are in support or not in support. And you mentioned that there is already in place on the federal level that monitors especially the opioids and the other drugs that are causing issues with the patients that are being provided with such medications. And the comment is that you mentioned, and I would like to get some clarifications on this one. It says there on one of the comments that you mentioned, it says the use of qualified delegates should be better defined with a specific education or professional credential for eligibility. Can you clarify or give more information?
Okay, you're right. I did write those comments quite a while ago.
Yes.
I'm not exactly sure when the bill was put forward, but that specific comment, and if I remember correctly, what the PDMP was going to do was going to allow anybody who is delegated to have access to private patient information. And to me, that was just concerning because I think people who have access to that type of information should be qualified, they should have some type of credential as to why they would have access, as opposed to just a layperson who might be working there. That was the extent of that. It was just a privacy issue. And so to have a clerk or to have a secretary or somebody have access to private health information, I just thought was inappropriate. I thought that they should have a higher level of education.
Okay, thank you for expounding on your comment. And also there's on your comment that says this seems redundant because the PDMP should be accessed before any controlled substance is prescribed or dispensed.
That's correct. And since the PDMP is actually in place now, we actually do access the database before anything that is controlled is dispensed. I think where the redundancy comes in is that most pharmacy benefits managers, for people who have insurance, that information is also recorded, so that if I tried to fill something and somebody had filled it 2 days before this for the same medication, then there would be an alert that would end up on my system. So specifically, the PDMP is actually working quite well so far here in the CNMI in terms of just basically making sure that patients are taking their medications appropriately. So I think the redundancy issue at the time that I wrote that, I think that I probably would change my mind on that. I think that it was very beneficial at this point.
Okay, your comment was submitted dated August 26, 2021. It's almost
Yeah,
like
so
1
it's a
year.
while ago.
Yeah. So, and also in your comment, you mentioned that from some outside providers of their intent to refuse to register with the PDMP.
Mhm.
So,
Yeah, the PDMP is only as good as the information going in. And if you have a particular provider who prescribes such controlled substances and they don't want to participate in the PDMP, I don't recall if it was mandatory at that time or not. But if a physician or a practitioner decided not to participate and not submit the information to the PDMP, it just kind of makes it not as effective as if they were required to do so.
I think the legislation is requiring it as mandatory.
Yeah.
And then there's a penalty for not registering with CHCC to be part of the this program. So, is there any issues with your medical center with this? I'm sorry, but I don't know whether you have seen this legislation, but
Actually, I have not seen it, so it's hard for me to comment. I would just say also I'm actually an independent contractor, have my own business license, so I contract out with different clinics, and so I'm not actually an employee of Marianas Medical Center either. So when I go in, I see my patients and take care of them, but I'm not aware of any system they have set up there so far.
okay, thank you.
Sorry about that.
Yeah. Mr. Parker, I'm really impressed when I go to your pharmacy because you have all these young people that are your pharmacy is training, and I'm really glad that that is happening in our CNMI, and hopefully these youth, when they go to advance their education, that they go into pharmacy and come back and serve the CNMI. I also heard that you have sent a young individual who worked in your pharmacy for advanced education or to attend college in the States. And I would like to extend that appreciation on my part for taking that opportunity, and I hope more clinics will look into that and provide some support to our young people, especially those who are interested in the health sector. So I really would like to commend you and give you thanks for that effort. And I always feel good when I go into your pharmacy, because these are all young people, and I think they're really well trained on how to meet and greet people when they come into the pharmacy, and that's really good. You come in there not feeling good, but when they approach you and they're so friendly, you just feel good before you leave the pharmacy. So I really would like to thank your pharmacy for that effort. And I also have observed that more and more of our people, they go to the private clinics. However, I observe also that they're struggling in hiring registered nurses. Is your clinic experiencing that?
Yes, I think a lot of RNs, again, the registered nurses, it's more difficult. I think part of it is the cost of the RNs in most places. And just the ability to get full-fledged RNs. So there's LPNs and medical assistants, a lot of kind of step down from RNs that are there to help out. But really it's important to have 2 or 3, like in a clinic, RNs, because if you have a really sick patient, us as physicians, we want somebody that really can to help us take care of them, and RNs can do that for us. So, but it is hard to retain them, I think, here in general in the CNMI, but part of it is the compensation issue.
The reason I asked that, because we have currently we have a nursing scholarship at NMC, 20 slots for every year for 5 years. However, the scholarship, the nursing scholarship, upon completion of their education at NMC in nursing, and then they pass NCLEX and they're registered, to pay back the government, they have to work only at the CHCC, Tinian Health Center, and Rota Health Center. So there's a draft legislation which will allow these nurses also to open it up so that they can also work in the private clinic rather than only in the government-run health centers. Do you support that?
I think that's fantastic. I didn't know there was going to be scholarships, so at least I know actually to tell some people that are interested. And I think it will help the private clinics. I think that's great that you're opening it up. I would have to say, from my standpoint as a physician, I actually encourage most nurses to do 1 to 2 years in hospital first anyway. That's where they get the really sick patients and good experience. And I think that helps them in the outpatient. So I still would encourage them 1 to 2 years in hospital first. But if we get them for a few years and then they go train in the hospital after that, I think that's great too.
Okay, thank you.
Thank you.
There's a there's a private clinic that invited me to visit his clinic to show me the technology, the upgraded technology that they have put in place, and even telemedicine. But his only issue in the clinic is that they really wanted to hire local nurses here who are registered. But he knew about the scholarship, and he asked me if I can look into that so that they can also be allowed to hire some of these nurses in the private clinics rather than going all to the hospital. So because that's 20 every year, in 5 years we're going to have about 100 of these nurses. So it's nice to hear that private clinics are willing to hire and train these nurses locally rather than going abroad and leaving the CNMI. Mr. Chairman, I have no further questions or comments, and I would like to yield you back.
Thank you, Vice President Kilwa. Now I'd like to recognize the Vice Chairman of this committee, Senator Victor B. Hokuk from the island of Rhoda.
Well, thank you, Mr. Chairman. Thank you, Dr. Willis and Mr. Parker, for once again accepting the added responsibility from your busy schedule with your business operation. And I understand the challenges that you may have been experiencing with the other members of the Professional Licensing Board. And I'm very grateful that you will continue to serve the Commonwealth and provide service to our people. I don't have much question, but just for probably clarification on some of the issues that I have on hand. Senator Kiduga has expressed also some of the issues on the impending legislation that the Senate may act on that piece of legislation. And nonetheless, I just want to find out for any licensee, licensed physician that have or had been practicing professional service as doctors that are away from the CNMI, how is the board addressing those doctors that needing to renew their license in their absence in the Commonwealth? Do you still renew them, or what type of requirement requires of them to facilitate continuous renewal?
Well, once again, the technology issue is kind of a barrier to any health care profession who is off island trying to renew their license. Renewals, we now have a website where a practicing physician, let's say in Oregon or Washington, they can download the application, but it's still a paper application that they have to fill out, and then they have to mail it in with a check, and then we review it, and then we issue the license, which is mailed back to them. So the process does work for physicians who are not located within the Commonwealth. But once again, it is a tedious process because it relies on the U.S. Postal Service and paper applications and whatnot.
So, Mr. Parker, you're telling us now that any physician can renew their license in their absence in the Commonwealth, provided that they meet those criteria?
That's correct.
Okay. I understand that you guys make mention about the challenges that the office is experiencing to meet those that you just make mention. And is there any recommendation on hand from you two that the legislature can look into? Most particularly, the budget issue is forthcoming, and we may look into the importance of the operation to essentially provide, expediency of the challenges that you are now experiencing in that board. Is there anything that you may provide the members to look into and try to consider to facilitate, if not all, but at least the critical part of the operation for the board members to expedite their services.
Yeah, I think I think the two biggest issues that were raised today, once again, with the new and renewal applications being a paper process, having the ability for people to just go onto our website and be able to download and pay online. And I know that's a matter of getting our own account and having it go through finance and all of the paperwork associated with that. I won't pretend to know how how difficult that is. I don't know how all that works, but that is one thing that would really, really help in expediting our application process for the people who do apply. The second thing, once again, is having a full-time investigator. We do have applicants that do apply here thinking that we're some kind of backward nation, that we don't pay attention to the applications coming in. And so they have a history of either wrongdoing or malpractice or whatnot, and they feel that they can just come in and work here. And having the lack of a full-time investigator on our staff that has the technical aptitude to actually research these applicants, I think would be very, very helpful. I think those would be the two biggest things that would be very helpful in making our jobs a lot easier.
Okay, so that is a critical needs for the board to ensure that they have one health investigator and the personnel.
It would be, I'm sorry.
Is that one that the professional licensing board office need one professional health investigator?
Yes, it would be very helpful.
Okay.
Yeah, we have an investigator now who does local investigations, but doesn't have the capability of doing anything that's off island, and which is where most of our investigations occur.
Okay. Now, I know the challenges of professional health services in the CNMI, be it nurse, physicians, or whatnot. And how, or does the board ever discuss, how can we avail to hire, like CHCC, hire, or any private clinic, hire any medical profession or nurses, let's say from the Philippines or what? Have the board ever discussed how can we work on that to ensure that we meet the necessary services from these professionals?
That exact issue was brought up, I believe, several years ago. And as such, we did, at least for the physicians, the regulations were written to allow foreign physicians to apply for a medical license here. Other professions haven't been considered yet. And in terms of nursing, nurses have their own board here, so I can't speak to them. But I know physicians have a pathway to licensure if they are a foreign trained physician.
So at this point in time, the professional licensing board can address those applicants should they have expressed interest to work with any of our health providers here,
Yes.
and they can be certified by the professional licensing board.
Yes, we actually belong to the National Practitioner Data Bank and the, what's the medical one? Yeah, the Federation of State Medical Boards. We are a member of that organization, which will actually do the investigation and the research on foreign trained applicants for us. They also have a listing of foreign medical facilities that are approved that would allow physicians who are foreign trained to not only enter the United States, but obviously to be able to practice here as well.
Okay, so that should clear a little bit of my concern regarding that, and I hope that the board can continue to come together and assist us. Our people on the cinema provide the best providers if and when their application comes in for your review, and I will we will look into providing the office with a critical personnel that can and will investigate other foreign or outside applicants that need to be uh, looked into of their credential, whether they are true and correct or are they legitimate applicants. Uh, we don't want to find out later on that the applicant from somewhere is just taking advantage with his little experience in the health professions, and that will impede probably the healthcare and the services of the providers. So, Mr. Chairman, I don't have any more question, but other than to again extend our sincere appreciation for you two to continue providing the professional services and help guide our uh, Commonwealth Fort in providing the best providers for public health care. And thank you. Ayo.
Thank you, Vice Chairman. I recognize Vice President Kiruga.
This is Masiya, Mr. Chairman. For Mr. Parker and Dr. Willis, I recommend in terms of funding, I recommend that you discuss this issue if it's not done so with the executive director, Mrs. Fleming. And I believe that the governor can help with the ARPA funds in upgrading the system in the office so that you can accomplish and be efficient and effective in your duties as board members. And it's also not it's I don't think the governor will say no if ARPA can be used for to upgrade the electronic system, and I think even the personnel for an investigator, so that like the vice chairman said, we don't want to be licensing physicians who are not actually what you mentioned earlier. They think that we are still far behind, that we can accept and bring in any individual that says I'm a doctor and I will serve your people, and then at the end you will find out that that particular person is running away from some bad practices and coming to the cinema to continue those bad practices. So my recommendation, while we are working on the budget for FY23, that again discuss with Mrs. Fleming so she can meet with the governor and ask the governor assistance on making available some more funds for operations, and I believe also for that very urgent and needed position, the investigator. And I agree with the vice chairman that we will look into the budget when it comes to the Senate and see where we can help the board and the office expedite whatever it needs to expedite. And this has been an issue not only with your board, but other permitting agencies where it takes 6 months to complete your whatever permitting you're looking or you're seeking, to get your license. So I hope that this will not be a setback with your board. And um, don't tell your executive director, said, try, give it a try. It doesn't hurt to try asking the governor for help. And at the same time, I will support also looking into FY23 budget to support the office and the board perform its duties in the most efficient and effective manner. Okay. Mr. Chairman, thank you.
Thank you, Vice President. And again, good morning, Dr. Willis and Mr. Parker. I know that in the past we don't go deeply to the duties of licensing board, but this is very important because with receiving information and also reading the paper in regards to prescription drugs that are entering the CAMU of that possibly not authorized by federal. But anyway, you mentioned lack of staff to investigate the cases. Ms. Parker, you mentioned about investigators that you have, the licensing board have investigator at the moment, or you don't have that?
My understanding is that we do have one person that is listed as an investigator. But once again, it's all of the local investigations that he's responsible for. What we really need is for people who are new applicants coming out, when they're coming from the States or from another country. That's where our need is right now.
So is that the same as the licensing officer? Is that same person? The investigator? Is that the licensing officer?
Licensing officer.
No? Different?
I don't know what their exact titles are.
So you don't have any licensing officer at the moment?
Not that I'm aware of.
Okay,
We-
so
we have our executive director, we have our clerical staff, and then we have our investigator. Those are the three we have.
so as a government appointee board of director on licensing board, do you look into, you investigate private and including government institution, right? That's the duties of,
Well, we don't do institutions, we just do individuals.
because I'm very concerned about, a repeat complaints at the hospital, like CHCC, that I don't know what is the normal time for a patient that's coming into the emergency room for a doctor to come and see the patient. In the past, we asked the administrator and even the board that it's approximately maybe 15 minutes, but we've been hearing patients complaining about 1 hour to 2 hours before any doctor comes, and I think this is very important that your office should look into this and see what, and you have I recommend that if you have to meet with and collaborate with the board of directors down there at CHCC, maybe we can resolve this, but this can continue to repeat. And I think this is the only way that we can resolve this kind of public complaints. We don't want our institution to look bad in the general public, that we don't have faith or trust in our institution. This is the only hospital here in the Commonwealth, and we don't want the general public to have the faith and the trust in our institution. So I think it has to be look into this matter and see how we can resolve that the waiting time of the patient. Patients that are calling me, they said not only that it's that they are referred to the emergency, meaning emergency cases, meaning patients are in pain, but they feel more pain by not knowing when, and what time the physician will come and look into their cases. I know there's some confidentiality on this matter, but I think it has to be discussed by within your office and perhaps maybe the the institution to get this thing, resolved and alleviate some of those complaints from the general public. I don't know if this something that is doable by the licensing board office to bring this attention to the board, or they have their own.
We actually have a fellow board member who's actually an emergency physician in the emergency department at CHCC. I wasn't aware of the complaints that were coming in. Anytime that we receive a complaint, it has to be signed by an individual before we can even look into it. But I can bring this to the attention of our fellow board member who actually works in the emergency department there.
I'm pretty sure that if you have that investigator look into this, you will find a lot of those cases that because this is not just once or twice or three times; it's many times.
Yes.
So I think we should look into this and see how your office can also like what the chairman mentioned. The provider should provide the best services to our patient. And now in regards to license pharmaceutical or something like that. Do you have any cases that are not pharmaceutical that are selling prescription drugs that is not supposed to? Do you have any case? Or
None has been
No?
officially reported to the board, from my understanding.
is
I haven't seen any.
is by antibiotic a prescription drug?
Which one?
Antibiotics are
Yes, they
prescription
are,
drug.
all antibiotics are prescription drugs here.
There's no antibiotic that is not prescription, right?
Just the topical triple antibiotic and things like that. But anything that you ingest has to require a prescription.
Yeah, because I don't know if it's already resolved, but in the past there's some grocery stores that are selling prescription drugs, and our people, especially consumers, they don't really understand the negative effect on our body when it comes. Because I remember whenever your a doctor prescribe your medication, it's only for maybe 7 days, but some of our residents are relying on antibiotic because it's also a painkiller, but they don't fully understand the bad effect in their body. So if there is still stores that are selling that, do you also enforce those, or?
We don't have an enforcement arm on our board. My understanding, working with the Bureau of Environmental Health, they do. And they do inspections in grocery stores and other businesses here that have been sought out for selling prescription drugs without getting the proper permits. And we do work with the Bureau of Environmental Health when we do find out those stores.
Okay, so
And they have the capacity to go in and confiscate and write up the complaints and any kind of citations they need to do. But they have the enforcement to do that. So we work with them when that occurs.
thank you. So just what the vice president mentioned earlier, that if there's anything that the legislature needs to assist your side, let us know so the least we can do is legislation. I know that he mentioned earlier about that legislation that is still within the committee, and he clarified about your comment on that. So if there's anything else that this board needs our assistance, are those always open for that and to discuss issues that will protect the consumers of the general public. So again, I ask that you continue to work with the on the board and the secretary director to see what the office can do to make sure that the protection of the health of the general public. So with that, thank you again for your time. I know this is not a paying job; it's just a volunteer job, but we're relying on you to protect the members of the general public. So anybody else? I recognize Vice Chairman Oku.
I haven't really heard from Dr. Willis, and only Mr. Parker has been giving the committee. So I just want to have you share some of our conversation uh, regarding your, the entity or the agencies that you have been providing the services.
I apologize. What exactly is the question with
For
regards to?
example, your private
Yes.
operation,
Mhm.
which of the clinics or health provider you're providing some assistance?
Mainly right now, I contract out with Mariana's Medical Center, and that's where I'm providing most of my care at this time. In terms of, I mean, just touching on a few things that you guys talked about was just I agree with what he mentioned about the antibiotics and the grocery stores and stuff. Through time, it is frustrating over the years if someone comes in and they took 2 days of amoxicillin, and then they come to me and amoxicillin isn't even the drug that they should be taking. And then I ask them, well, where did you get it? And they will mention like, oh, grocery store, or friend or whatnot. And I'd always inquire to where, but they never say. They don't want to get anybody in trouble. So I can't even report anything with regards to that, but that part was frustrating. And I think as Mr. Parker mentioned that the complaints of specific places we did get, he was able to follow up with the other board to be able to look into it better. With regards to the investigator, again, that kind of does our stuff here on island. Again, it's not just into issuing licenses, but it's mainly the complaints we get. So whenever we do get a complaint in writing to the board and signed, then that investigator does go out and talk to everybody involved with the complaint to come up with something that then we review and decide if it goes on further to further investigation and looking into the license of that person. So that's really important that we have him doing that for us. But again, the other investigator full-time would be great for all the off-island stuff we get. Just because we do get so many at this point in the last year or two in particular, I think because of COVID, people think that they can just come here and get a license, and a lot of them have had trouble pass, so we need to really look into it. It takes us more time. Usually we like the turnaround time within a month to get people licensed, but sometimes it can take 2 to 4 months. I have to admit some states that are much larger take sometimes 9 months to issue licenses. So we're still pretty quick compared to other places, but it really delays how quickly we can get somebody in by not being able to find everything out quicker.
Thank you, Dr. Willis. And just for curiosity, do you prescribe medication as well?
Oh, yes, definitely.
Okay.
Yeah, I do.
So those are the services that you are assisting other medical professions, no?
Yeah, so I'm family medicine, so I do pretty much from newborn all the way up to elderly in my practice, and pregnant women, pretty much everybody in family medicine, the whole family. So we do pretty much everything and taking care of them, diagnosing and treating and all the medicine. Yeah, so Mr. Parker, I talk to frequently over at Brabu for a lot of my patients.
Because at times, Dr. Willis, in the family setting, when someone get, a gout, no, for example,
Yes.
one of or a friend member will say, "Oh, you can try this. Try this because it works for me."
Mhm.
But sometimes, I told them that, not all gout medicine and not all gout are the same. So you better go check a doctor before you take that.
Right.
And sometimes they force themselves to take that kind of medication because of the unbearable pain.
Mhm.
And then, after a couple of days, they complain that their feet or their joints are getting more painful than before. So I said,
Mhm.
there's a doctor. Your friend is not a doctor, so don't take whatever he took, for his
Right.
medication because it's totally different.
Well, thank you
Yeah.
for having him get the medical care he needs.
Yeah, so thank you, Mr. Chairman, and and again for you too, Dr. Willis and Ted. Thank you again. You've been a good pharmacist as well, business operator. So help us with meeting the new type of medication to be at yourself on yourself that are either prescription or non-prescription, so that we can avail the services as what Senator Kidu was saying, that you have the best pharmacy provider on island as well. So thank you again for the. You, Mr. Chairman.
Thank you, Vice. I now recognize Floor Leader Sabrat.
Thank you, Chairman. Just a quick question. Since we've been talking a lot about providing the board with an investigative position or two, but how often do you perform investigations? Say in the past year, or how do these come up or get triggered? You say, like, do we get calls in from patients or from other physicians or
Again, sorry, are you
okay.
talking about the investigations into a complaint?
yeah, like disciplines,
Oh.
like because part of the on Title III,
Mhm.
Division 2, the subsection 2206, which is the powers, duties, and functions of the board, right?
Right.
Under K, it's discipline, including refuse to issue or renew, fine, reprimand, suspend, revoke, place on probation.
Yeah.
How often, and you've been serving several terms, how often do these disciplinary actions occur?
In terms of complaints, maybe, I don't know, a handful every year, maybe 5 or 6 a year. Yeah.
And just random calls in? Is that how
Well,
they kind of come about?
We do
Yeah.
get calls in, but unfortunately, it has to be a written complaint. And there are some people that don't want to put in a written complaint. So we really try and convince them that there's nothing we can do unless we get that written complaint in. And so most of them will eventually say, okay, I'll write it in and put their name down. And then we're able to start the investigation.
Okay. Then that's when the board meets and decides whether the investigation is warranted, correct?
Yeah.
When physicians or other healthcare professionals are licensed and allowed to practice in the CNMI, when they depart, do they have to notify the board or no?
No, they do not.
They don't. Okay,
No.
so there's no data on the turnover, how many physicians come in or any healthcare
Yeah.
professional.
There's no
yeah.
data unless they let their license lapse and not renew, and then we'll know that they're probably not here. But other than that, there's nothing.
Okay, I was just curious on like turnover on
Right.
physicians and other
Yeah.
professionals in the CNMI. So
Yeah, actually, the data we don't have. I mean, in general, we all kind of know that nobody lasts too long. Sometimes 2 or 3 years, it's very frustrating for us. I mean, especially for specialists that come and go, just not having people to refer to. So just, of course, being here 20 years, I've seen it a lot, and it's just, it's hard. I wish we could keep people here longer, and then they stay.
and I believe the CNMI is still I don't know what's the term with I think it's under the WHO where you practice at certain jurisdictions and then you get this incentive off your schooling, your school loan or something at need, or is the
Mhm.
CNMI still a part of that? I was talking to my wife once and she said a lot of the physicians come here and they'll put in several years here and say Africa and other places where physicians are
Yeah,
needed.
So that's the
and then they take
loan
care of
repayment program.
yeah, and then they take care
Yeah.
of like
So
percentage of your
we still do have that here. That's
Uh-huh.
CHC offers. I think it's a minimum of 3 years. You need to. It might be 2 years. Cagman Community, I know, finally got it also, and I think their requirement is again 2 to 3 years. So if you commit and you stay that long, then the government will repay partial amounts of your loans, and it just depends in terms of the amount per year. But yes, kind of underserved area for loan repayment.
Do you think it's back to my first question? Do you think it's important for these physicians or healthcare professionals coming in and then departing? Do you think it'll be a good thing for the board to know that they've left, or I'm just trying to wonder whether it's something we can put in the legislation or maybe some policy in the board. You don't if
Yeah, I do. Again, I know it's different everywhere you go. I've maintained 5 state licenses all these years, and I mean they're bigger places, so they don't keep track of any of it, and so I haven't practiced in any other place here, and a little bit in Oklahoma for a month or 2 here or there, but I always keep the licenses active just in case I need to go help out someplace. But I think it would be easier to look here. I mean, if you're doing it from a data standpoint, I'd try and probably look at how to retain physicians more. That would probably be my focus, is how do we keep them here longer? And that may be something you can do through higher loan repayment programs or longer 5-year ones if it's a higher amount, just to get people to stay. I mean, just different ideas, but I think that would be a good focus.
Okay, I was just kind of because we want to try to keep them here, and if we can determine or identify why they just keep coming and going, then we could kind of come up with something, either pay them higher or give them some incentive to stay, or it'll be nice to kind of know why the high turnover or
I think a lot of places, but it's not just here, is just the spouse's satisfaction when they come, if they're not also a doctor. It's just more rural areas. It's harder to retain people even in the mainland. And part of it is just keeping the spouses happy, I think.
Okay. I thank you. Thank you, Mr. Chairman.
Thank you. We're done with our questions and concerns regards to your appointment by the administration. At this time, all comments are well taken. Let the record reflect that there is also written testimony submitted by the Executive Director, Esther Fleming, of the Board of Professional Licensing and Healthcare Professional Licensing Board in support of the appointees. And will be included in the Senate Standing Committee recommendation report, along with all testimonies presented this morning, to be forwarded before the full Senate members in consideration for confirmation or rejection. At this time, before we adjourn, I would like to extend on behalf of the committee our sincere appreciation and gratitude to Governor Torres' representative, Mr. Jason Palacios, along with Ms. Shai, the appointees, Dr. Tiffany Willis and Mr. Theodore Parker, and most especially the members of the general public for your participation and involvement during this important public hearing process. And we certainly hope that we continue this dialogue of communication between us, the elected officials, and the public, to keep you abreast and informed of our current and future Senate hearings ahead that relates to public best interest. This concludes this public hearing for today. Do I hear a motion for adjournment? There's a motion and was seconded for adjournment. All in favor of that motion, say aye. Opposed, say nay. Motion carries. This public hearing is now adjourned. Thank you.